So, we welcome once again. Today, we are looking at record identification system, filing and retentions of health records as our new units. Yeah. So, if you check our course structures, you see that we have record identification system, filings, and retentions of health records. So, why should you study this course unit? This unit introduces you to different record identifications and filing systems that are used in health records management. So, record identifications may be in two ways. You can identify your records alphabetically, or you can identify your records numerically. So in order for you to identify your records alphabetically, it means you should also file them alphabetically. So if you file them alphabetically, you will be able to identify them following the same alphabetical procedures. And on the other hand, if you file them numerically, you will be able to allocate them only if you follow numerical filing procedures. So the filings and identifications move hands in hands. All right. So the filing system used in the facility as well, it depends on the identification system of the records that are being employed. So like I said before, if the employed systems of identifications is alphabetic, that means your filings must also follow the same procedures. Although some healthcare facilities in a country and around the world, I have already adopted the use of electronic health records. Meanwhile, most of the healthcare facilities still, maintain the patient records in paper-based formats. So even if technology is there, but still there is need to have a paper-based records within the hospitals. So we are going to be dealing with various methods to identify paper-based file records, also different identification and filing systems. We shall be talking about different procedures, identifications and filings as well. So the record identifications and filing systems is the first steps in a series of procedures in the management of health records. So you must understand how your records are being filed and how they are being can be identified. So in order for you to have a very effective running of medical record departments, and we all know that for a good medical care, medical record department must be well implemented and managed. So if it is poorly maintained, it will definitely reflect the poor services that are provided in such healthcare facilities. So we understand that the medical records has no value if you file it and it cannot be found. It cannot be found after filings. It loses its meaning and its purpose. So careful planning, therefore, for medical record department is very important. And last time I think we talked about the planning of health records at the department. I don't know whether you talked about it last time or it's something new. So so the choice of the systems that you will be using in your healthcare facilities will depend on the specific types of the circumstances of the healthcare facilities for which it is selected. So first of all, it depends on the level of the healthcare facilities. The level of health center 2, you cannot compare it with the level of health center 4 because in terms of the capacity and the services provided. So we have some of the objectives here, but I want you to take a note of that. Find time and revise through those objectives in your own free time. But for now, I am diving with you straight to the topic, the first topic of these units, that is record identification system. So now, when I talk about identifications, It is a very simple kind of one that, yeah, each and every one of you can understand it perfectly. So in a facility, we know very well that the commonly what we do in a daily basis is collections of patients' identification data. Okay. Then after the information has been collected, before the patient left the facility, we must have given them the number or whatever that can identify them, or we must have registered them with the facility. It's very important. Very, very, very important. You can do all the necessities demanded, and you must be able to establish the rightful procedures in your identification steps. So the collections of patients' identification data and the assignment of a record number or verifications of an existing record number should be the first steps of every admissions or visits to a hospital or health center. It is only way to ensure properly identified health records. So we commonly do three things which are very important. Number one is the collections of patients' identification data. So the next step that follows that is assignment of health record number or verifications of the existing health records. So you will do two things. You will do one of the two. Either you will be able to assign the new health record number to that patient, or you will be able to verify if that patient have health records with you in the facility before you can be able to assign a new health record number. Why do we do that? Because we are avoiding any mistakes of sharing or maybe giving one person two numbers at the same time, or maybe at the end of the day the patient will be able to have two records in the facility because two different records are registered under one name and under the same number. So which means it belongs to one person. So that's the kind of error that is there is need to remove it from all the filing procedures and the management of health records to ensure the effective quality services for every patient, regardless of being inpatients, outpatients, emergency patients, or any other. All right. So when you verify the existing number as a first steps, then you can be able to do the filings. All right, so now we have types of record identifications. Number one, we have alphabetical or alphabetic identifications. So these are the simplest forms of record identifications because it simply uses the patient names in order to identify the patients and also file the patient records. So all you need to know in this case to file the patient records alphabetically, you only need to know the patient's name in order to arrange your files. So now it means that if you have, for instance, 10 patients, out of 10 patients, one patient must be the first. So it will depend on their alphabetical name. So in this case, files are arranged like words in the dictionaries. So dictionary consists of the information based on the what? On the letters. So in this case, any patient whose name begins with letter A and should be the first is going to be picked first. That file will go into the shelves as the first file, following another one, while you're following the alphabetical order and until you complete your filings. All right, it's a very, very simple filing system, very simple filing systems. But the problem with it is that there may be a possibility of maybe incorrectly writing the patient's name, and therefore at the end of the day the records may be filed in a different shelves or in a different columns, leading to a saying of a loss of records, of which it may not be true just because of misspellings and the search is going on but the records cannot be found. Why? Because the record might have been filed under different folder within the medical record department. Okay, so and also we depend on the patient's names only when it comes to alphabetical filings, and therefore it becomes the very easiest method of retrieving the medical records within the medical department. However, the problems I've talked about, that in the situations where the patients may be sharing the same name, it may be very difficult for you to do the effective filings. And also in the facilities where the rates of admission is very high, it becomes also perfectly hard for you to do the filing using alphabetical filing system. But like I said, it's the easiest. Why? Because you don't need a master patient index to do your filings. You don't need any cross-reference to do your filings. So it is always a direct filing. As long as my name is the first, my name goes first, which means my file will also go first in your filing system. And therefore, like I said, the accurate spelling of the patient's name is of extreme importance. It is also important to create a system to track name changes, such as from marriage or divorce. It is necessary to thoroughly train staff to verify patients' names and spellings and to accurately and consistently file the health records. So there are a few things which are very important if you are filing your medical records using alphabetical filing system. So in this case, you will first of all consider making sure that the patient name is very correct. Two, you must make sure that you have a track system, a system that can help you to track whether this patient has not been in a hospital before, or he or she might have been in a hospital who might have been seen under different name. So we need to do the tracking and make sure that we don't make any mistakes of giving the same persons two numbers, of giving somebody who have a number already another number, or maybe assuming that somebody has a number already yet the person is a new patient. So the concern is very, very important. Okay. Another important concern that is also very vital is the concerns of patient's confidentiality. When it comes to the patient's name, it is most likely that if you're filing based on the patient's name, it is most likely that the names of the patients may appear on top of the file because that is what is used for identifications, which is not healthy and safe for patients' identifications. So the NB I can say is that the alphabetical filing system is not effective for a bigger hospital or a facility with high rates of admissions. Okay, it is commonly used in the like of health center too, because their rates of admission is very low, and at the end of the month may not even go beyond 26 or maybe less. So I think it is easier because even if we choose to use numbers becomes too much for them. So we choose to use alphabetic numbering system. Okay, so now let's look at the advantages of alphabetical filing system. Number one, the method is simple to learn, understand, and operate. Number two, it is safe indexing. Therefore, there is no need to separate the index from them. Now I said this, that the moment you're using this method, you don't need to make a cross reference. So that is how easy it is. It saves you some little time. Number three, it provides basis of direct reference and chance of misfiling is eliminated. So basis of direct reference is basically when you are able to make a cross check over in a situation whereby before you can issue the patient's card or maybe open a new file for them, you may need to first of all check through every file. Is the name of the patient not there? Is the record number not given? All that. You may need to look at all that. But it's not necessary when it comes to filing alphabetically. And also it facilitates the provisions of miscellaneous papers. So when I talk about miscellaneous, I'm referring to additional spaces and also extra spaces within the filing areas. And also this method is elastic because you don't need to introduce any specification of the heading, by the way. That's what I mean by elastic. You can be introduced anything, you can write anything on top of behind the folder, and it becomes very easy to carry out your identifications. So disadvantage is that it requires a lot of time to identify records because you may have like 200 patients who are sharing the same name or their name begin letter A, which will mean you are still supposed to make a selections among the 200. You're looking for something one only. All right, paper may be misfiled due to the misspellings of patient's name, of course, definitely, and that will lead to a failure to retrieve the records in time or delays in service delivery. Then the other one is that the method leads to congestions and confusions if there is a common name. So congestions of the files within one area, it is possible. Why? Because if you have 1,000 members whose name begin with letter A, there is no way you can take them to the group of letter C. Even if you see there are only 2 records, but you cannot take them there. That will lead to congestion. All right. So then now we have numeric identification. The word numerical is actually coming from numbers. So a numerical record identification system requires that a unique health record number be assigned. For example, we have a patient, Dorcas. We shall give the date of birth, and then we shall give the department, and then we shall have to give the health record number. So which means Dorcas will have the date of birth, right? Then department, inpatient, and then health record number 0264141. Get that? So this is a unique identification number which must be assigned to every patient. And of course, when patients are coming, they don't have that number, especially new patients. But for existing patients, those one who have a record with you, that means they have a health record number. So we talked about it in the patient's identification last semester. We said that how do you get to know that somebody does not have a health record number? You ask them a questions, and then we say, however, no matter what they will say, you still need to go into your database system and check if the patient has actually have a number or maybe does not have a number, because there's a possibility that they may be saying so, but they are forgetting the truth. Okay, so apart from giving you the patient a unique number, also numerical identification requires the use of a master patient index. You need a master patient index for the cross-reference. So meaning before you can issue this number, you must first of all check on your master patient index with that patient's name as reference and the date of birth that you have collected just now. And if you go to your master patient index and you do not find anything related to that patient, that will tell you that that patient is a new patient, and therefore he or she needs to get a health record number. And then for you, for any other persons who has already been there in the facility, that will also be need to verify. And for the new patients, just make sure that you give a new number, but before, not when you have not confirmed. So, all right. So now, numerical filings, numerical identification has 2 types. We have a serial numbering system, then we have unit numbering system. Now, serial numbering system, it is commonly used at outpatient department. And I believe that you're coming back from the field. So from the field, you have been assigning this number every day to the patients, okay? So therefore, outpatients number, we actually found them in the registers, okay? So when we are issuing the serial numbers, we don't care whether this patient was there yesterday We don't care whether the patient has been in the hospital some time back. All we do is assigning of new health record number. We don't care. The word is new. Okay? Whether the patient has been in our facility before or not. We don't care. Even if you have just received a treatment now and you come back, we shall still give you a new number. Are we together? So we shall use that number for identifications at OPD department strictly. And then for unit numbering system, unit numbering system is a system where a unique number is assigned to the patients once. We give them this number once, and this number will be kept to be used. It will be kept to be used at every subsequent visit. Are we together? The difference between serial is that serial and unit is that serial, the number is given, the new number is given every time a patient comes to the facility, regardless whether the patient has been there before or not. But unit numbering system, we cannot give you a new number if we have not confirmed whether you have it already or not. Therefore, if you are a new patient, we are going to assign you a unique number, and that number, we are going to keep it, and we shall be using it every time you come back to the facility. We shall be what? We shall be using it. Okay? And that is now the series where the filings is done seriously. You need numbering systems. Okay, so I've explained it into details here. And I said, with these methods, the patient receives so sorry about the noise. So I was saying that with these methods, the patient receives a new number, a new health record number on every inpatient's admissions or outpatient's visit to the hospital or clinics. And that is, the patient is treated as a new patient each time with a new number, new index cards, and new records, which should be filed totally independently from the previous records. So if I've been in the facility yesterday, you file my records, right? You gave me a number. Today, if I come back, you will still file my records and give me a new number, and you are going to keep this record that you filed today separately. You will not combine it with that one of yesterday because that was of yesterday. So the records are filed independently. So it means you're going to be preparing everything, including the index card, the new number, the files, and all the things that is necessary. All right, so, but of course, it is a very disturbing method when it comes to filing. So we don't use it for filing, and we strictly use it in OPD only. So that is the reason why, if the last number of last evening was 261, tomorrow if you get back to work, your next number will be 262, 263. Like that. Now, I normally know, I am very sure that when you are now writing it, end of this, on the patient's medical form, this is how you write. For this one, you write it 2, 6, 1, and you put it out of something. Now, out of something, for instance, this is FAB. If that hospital uses their numbers or they changes their numbers after every month, that means we are going to be using FAB. And this is the OPD number. So this one represents the divisions of the number at the facility. However, now, meanwhile, if if uh, the 261, okay, and our number is divided by year, that means we go from 01 from the 1st of January up to 31st of January. So it means we use as what? The year. So this is 23. You get it? So this represents the year of divisions. So if it is like this, 261 out of 02, which is, so this is the month, okay? Then this is the actual OPD serial numbering. And this is also could be the inpatient numbering, or maybe the serial numbering, or the unit numbering. But what I want you to understand is what you normally write under every number that you assigned. Okay, so moving forward, we have unit numbering. So unit numbering is a system where the patient is assigned a unique identification number on his first contact with the hospital, whether it is for admissions, emergency room, or outpatient clinic visits. Therefore, later the same health record number is kept and used on all subsequent visits, whether they are inpatients, or outpatients, or emergency patients. So a unit health record number results in the creations. Results in the creations of one central health records for the patient. So this one, you cannot be using that systems and then you have health records being kept in different places. Okay, you may need a central health records for all the patients. Let's look at the advantages. In this case, the number is unique, definitely. We give a unique number, and which makes identifications of the patient becomes easy. So what really, it will actually be of a great help, helping you to distinguish between one patient and another. And also, the number doesn't change regardless of how many times a patient comes to the facility. We shall keep giving you the same number. 2, the patient health records are centralized in one single folder, which makes retrieval becomes easier, and also management of those records. Another one, the system provides the medical staff with a complete picture of patient's medical history and treatment received over a number of admissions and attendance. Now, the difference here is that for serial, imagine you give a new number every time, right? And then while filing, you file independently or maybe separate, which means if you want to combine all details of the patient, you're supposed to be checking how many times as a patient. It is very disturbing. But for units, if your number is 261, that is it. So when we go into the system and we enter 261, we know that belongs to you. And it will give us all the clear picture of details of how many times you've been in the facility. Doesn't matter whether it is a million times. One search can get you everything that you want. Another advantage is that health records are filed in one place or location. Okay. All right. So the disadvantages of using a unit number for filings that health records may become quite thick. They may become very, very many, quite thick or maybe bulk, because one patient has come like 10 times and now the record has been created, they must be kept together in one file. So you're most likely to create like 10 different files for the same patient under the same number, because it will depend when the first file, because let's say the patient started admissions, the first file is full. You're supposed to open another file. So we'll name that one file 2. Yet is bearing the same number 261. Now this is file 2. It's also, it gets full again. Bearing the same number. You open another file. File 3. Get falls again. It's bearing the same number. Which means you're supposed to be able to keep them together within the same area. So the moment you see volume 1 and 2, and by the way, on the first file, you're supposed to, if that patient is having 3 files, you must indicate like volume 1 out of what? Out of 3. So you know that this is the first file, but there are 3 files in the filing area. I hope we are together. If we are not together, or maybe there is something you still need clarification on, you will drop a message down on our platforms, and then I will pass by and then do the corrections again or repeat where necessary. All right, then moving forward, we have a space that needs to be allocated to allow for the expansions of records as more admissions are added to the folder. So you must have a bigger folder, because a lot of things is supposed to be added on and on, even in the spaces of filing within the shelves. Is actually very important. So in the next lesson, we shall continue with the 0-unit numbering system. Yeah, definitely.